Ellen Pompeo might not only play a doctor on TV, but she's slamming real doctors, Dr. Phil and Dr. Oz, after they made some
Ellen just got
comments.
called out, Dr. Phil, for something super dirty. Hey guys, welcome back to Film Explosion. Today we'll talk about Ellen just called out Dr. Phil for something super dirty. Let's head into it. Ellen Pompeo shared her opinion. Ellen Pompeo, 50, took to Twitter on April 18th to speak out about her thoughts on the importance of staying home during the COVID-19 crisis, and also shaded Dr. Phil McGraw, 69, and Dr. Drew Pinsky, 61 in the process. The Grey's Anatomy star pointed out how being in quarantine can help stop the virus of the highly contagious spread to healthcare workers and others, called out Dr. Phil and Dr. Drew for their previous controversial comments that some feel downplayed the seriousness of the virus. Staying home is for very good reasons. One of them is to stop the spread to nurses, doctors, and anyone else who works in a hospital housekeeping, security, maintenance, to keep their risk of contacting lower, and the hospitals can only handle so much intake. Ellen tweeted in one of her series of tweets about the topic of seeing news stories against protesters marching against the stay-at-home orders in California. Then she called out old white guy TV docs.
One night should have cost you your entire career, but instead you're sitting up here judging me? You don't deserve to judge anyone.
In a tweet she stated, also the white guy TV docs who says stupid selfish shit should say, yes, walk that shit right back to your lazy boys and sit your stupid asses down in your living rooms on your golf courses where you live. Tired out of touch fools don't get me started today, she continued. So let's think about all our first responders and healthcare workers, home health aides, nursing home staff. Always, it's a much better place to put our focus. She went on to talk about the effects of sexism, racism, and other struggles that healthcare workers have to face every day before circling back to TV doctors and their careless statements. Also to those out-of-touch TV doctors, which I'm sure they would call me a lol. You took an oath so many years ago to do no harm. Making careless statements in this environment when so many healthcare workers are suffering physically and emotionally is defying that oath, she wrote. Ellen's tweeting storm didn't stop there either. She concluded by replying to another tweet that called out Dr. Phil, Dr. Drew, and Dr. Mehmet Oz, 59, directly for not acting like real doctors. I love this because they have been so busy in their dressing rooms getting their faces powdered and not worrying about their ratings. They have no idea what doctors and healthcare professionals do on the front lines, actually do, or they just don't care, her response read. She responded with a tweet with pictures of the aforementioned TV doctors. Ellen's tweets come after Dr. Phil and Dr. Drew both made headlines for some comments they made about COVID-19, aka the coronavirus, after the pandemic started in Wuhan, China in December. Dr. Phil compared people dying from the virus to people dying from car accidents, drowning, and other things when he criticized America's stay-at-home orders. 45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools, but we don't shut down the country for that. But yet we're doing it for this, and the fallout is going to last for years because people's lives are being destroyed, he said on Laura Ingraham's show on Fox News on April 16th. He later apologized for his choice of words after receiving backlash. Dr. Drew received similar backlash after he initially said that he thought the virus wouldn't be more serious than influenza, aka the flu, in a video that was filmed back in early February.
That doesn't get anywhere near the number of flu cases that you could be exposed to. And you are more likely to die of flu. You're as likely.
He also apologized later on April 4th and admitted that he had gotten it wrong. As of April 19th, COVID-19 has affected 2,365,269 people worldwide, including 162,129 cases resulting in death. What you should know about the virus. Given the tweets, everyone should know some basics to know why the TV reality star doctors are just wrong. Strict measures are critical for slowing the spread of the disease. Public health efforts have been aimed at flattening the curve. If you map the number of COVID-19 cases over time, the expectation is that it will peak at some point. On a graph, this peak would mirror a surge in patients, which could overwhelm the hospitals and healthcare providers. Flattening the curve would mean there would be fewer patients during that period, and hospitals would be better able to manage the demands of patients who are sick with COVID-19 and other illnesses. Infection prevention is key. There are many things you can do to protect yourself and the people you interact with. Wash your hands with soap and water for at least 20 seconds. Dry them thoroughly with an air dryer or clean towel. If soap isn't available, use a hand sanitizer with at least 60% of alcohol. Stay home if you're sick. Avoid touching nose, eyes, and mouth. Use a tissue to cover a cough or a sneeze, then dispose of it in the trash. Use a household wiper spray to disinfect doorknobs, light switches, desks, keyboards, sinks, toilets, cell phones, and other objects and surfaces that are frequently touched. Create a household plan of action in case someone in your house gets sick with COVID. Plan visits with friends and family outdoors. If you're going out in public, bring a face cloth covering to wear over the nose and mouth, tissues, and a hand sanitizer with at least 60% of alcohol. Experts are working rapidly to find solutions, but until then we need to protect ourselves from others from this disease. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I will see you in the next video. Goodbye.